I'm Vishnu Bharadwaja. I've finished my MBBS from College of Medical Sciences, Bharatpur, and during my medical course, I've met and interacted with several doctors in the topic of menstruation, both professionally and during my rotations in the clinical departments. I've also spoke about this topic to women, where I've understood people from rural areas and women from very lower economic background. I've understood the problem from both scenarios, and this created a very large impact upon me. So we started a project called Bleed with Pride, where we're talking about menstrual hygiene to and we're reaching out for lots of people. So for the first time since independence in India, we have a freedom to talk about menstruation today. Let it be for campaigns by Manushi Chiller, Menaka Gandhi's campaign, and Padman movie. There's a scenario where menstruation is being discussed as a topic of health, yet there are so many taboos associated. Talking about me, my childhood, I was the only child of well-educated parents. My dad is a doctor, and my mom was a law is an advocate and currently a judge, working as a judge, and growing up in a family, I received a lot of affection and love and care growing up in a family. And once I came up, I in my but since my early childhood, I was taught to communicate in a very proper manner. Right from my childhood, I was taking phone calls for my dad, and I was making his appointments. So that's where I started learning about communication. At a very early age, I was asked to give a small talk about on a big platform with lots of doctors, because I was able to deliver a topic in a proper and simple format. So this skill had started in me right from the beginning. Later, I did my education from 12 different schools, starting from nursery until plus two. So among this, because both my parents were government employees, we had lots of transfers, and during this time, I had a chance to interact with lots of people in every different school, always making new friends. So I was always able to understand the importance how we communicate a topic, how we express ourselves, and also how others receive ourselves to understand people and their emotions. So from this area, we were able to take it up to a next level. And I did my during my 9th and 10th, I had an opportunity to participate and present in number of science fairs. So in the last 2 years of my schooling, that's during 9th and 10th, I've presented over 15 different projects in about 9 science fairs, and I won each and every single one of them. Um, During which I understood the importance of research and background in science, and how to communicate the topic on field to number of people, because in a single day we were talking to more than 300 to 400 people, and this one after one on a one-on-one interaction basis, and this created a lot of impact upon me. And later during my 12th, I was able to I was able to interact with several people on different platforms. As soon as I started my medical education, in the first year itself, I was selected on a program called Elsevier Student Ambassadorship, where 10,000 people were screened in 7 countries, and only 150 were shortlisted. Among those 150, I was the only first year student from my college. And this created a platform where I was able to interact with several doctors, several medical students, PhD scholars at the same time. So I was texting them to know more about academic opportunities, research-based platforms, conferences, and any educational or academic interest groups. So this, right from the beginning, have created an instinct in which gaining the knowledge and communicating it had become a regular part of my medical curriculum. So as soon as I came to second year, I was participating in conferences, I was giving talks, I was reaching out for large number of people. And I've also developed a keen interest towards the field of research and science, where I was getting into lots of conferences. I was talking about scientific topic, explaining it to the people. So I understood the background, how we research a topic and then get into the scientific aspect of it, and then how do you deliver it. So the similar module has applied to me when we started the work upon an organization called Pravaha. Pravaha was an organization where we were doing blood donations for a lot of people, and this was a college-based organization where number of students were coming across, where we created a database of all the medical students, and any emergency case comes to our hospital, we get a phone call and we arrange the blood for them. So volunteering in this organization with an extreme commitment, we delivered more than 300 to 400 packets of blood in a span of 1 year, and we were able to collect fund of 1.5 lakh during my second year of college and third year of college, and we were helping lots and lots of people with that money to buy their medicines, sometimes to pay their hospital expenses. So this given a deep drive of passion to reach out for the community and to understand the community in which we are working better. So as doctors, this seemed very important to me, and during all my medical education, there was always a stigmatous topic, that was menstruation. Whenever we were supposed to take a gynecological case in any department and we ask about this topic, we see a hint of hindrance in women giving the history. Yet, though over time they become comfortable talking about menstruation, initially this hindrance has always been there. So a question about taboos associated with menstruation and how do you communicate regarding this has always been in my mind since the first day of college. And then one particular day I received a phone call from a girl called Ankita. So she was another medical student from a different college, 2 years senior to me, and we were interacting, who wanted to do a menstrual hygiene campaign. And at that point of time, we did not have any resources, we did not have any challenges, and so we started working upon digging up and developing a pattern of what are the things to be told about menstruation. How do we communicate it? We were estimating each and every challenge we would be having on the community and preparing for that. So we gathered up resources within 15 to 20 days, and we've done our first campaign in Sindhupal Chowk, which was the most affected area of the Nepal earthquake. And from there, once we seen the ground scenario, we understood the situation of the ground reality and the need of this particular need to talk about menstruation. And so the motivation for me to talk about my motivation has been all the women in my life, starting from my mother, my friends, my colleagues, everyone. And I was raised to be sensitive for the people's pain and to understand to be more sensible in my response. So this was raised to be more sensible and sensitive to people's pain and respond in a more convenient and a compassionate manner. So as doctors, we understood this, and and then when the opportunity presented to take this to the people and to help the people on the ground, I took in my leap, and since then we started reaching out for the community. In the past 1 year, we have reached up to 10,000 people in rural Nepal, and we were the first people to establish sanitary pad dispensers around the country. And now, as I finished my college, we came back to India and we have started this campaign. And during this module, we have come across a specific guidelines. So just because we were from the scientific backdrop, we didn't just wanted to go talk and end the session there. We wanted to make something permanent in this field. So, and the only thing, the thing what we could make was a specific guidelines, a session, and we have developed such a pattern. So during we have developed a module, a concrete module with which we are collecting the pre-session information and the post-session information and checking the success after each and every single campaign. So every single time we have 85% to 95% reach after our campaigns. And this module works with medical students, and we first go train medical students, at least to 30 to 40 of them. We divide them into small groups. We ask them to make their own names. We try to make it as much as fun for the students, because we're already all the medical students are extremely stressed in their college. So we try to make it as much as fun for them. And then we give them a basic guidelines with the impromptu measures that can be taken at each and every single step. Our campaign goes for about 1 to 1.5 hours, in which people start talking about menstruation, the basic anatomy, physiology, the process that's happening inside the body, and during which girls will be leading the session. So our module consists of both boys and both male and female medical students. And at the initial point, girls will be leading the session. And as we go ahead, we talk more about our session. we go into the problems, and during the problems we talk about pain and how do you manage the pain, then in a home care environment, and the nutritional problems which people will be having, and what are the foods that need to be taken. And then one among the most unique thing what we talk about is creating a safe space that is in your house. So how do you talk, how do you communicate about menstruation right in your family, with your parents, with your siblings, with your friends, with colleagues? How do you do this? So this is something we specifically train in our module, and we ask people to do a couple of activities to get familiar about the topic so they understand this. And then later we started developing a module for boys as well, because men need to be sensitive about menstruation as we are always surrounded by women. So and then at each point it was a very tough thing to gather the resources. We needed funds, we needed transport, and so it was costing a lot for our first 3 campaigns. So we came up with this new module. Instead of carrying the medical students everywhere, training a team of medical students and working in a specific volunteer based format, we broke it down and made it into a train the trainers format. So wherever we go ahead and train the medical students from a nearest college, gather those people and do the camping. Because of this, we have a resource of medical students today who are capable of talking about menstruation in a very sensitized format across a couple of colleges. And this pattern is giving us a lot of advantage, cutting our costs, so which we can spend distributing free sanitary pads. And we also established, we were the first people to introduce sanitary pad dispensers in the country, during which we had several problems including transportation, taxes, customs and everything. So we again created a separate channel for that. Now anyone in Nepal will contact us if they need a sanitary pad vending machine, but based upon, we have a couple of guidelines upon which we analyze the situation in the school, the economic backdrop of the students, and we decide if we can partially fund the project, or we will fully fund the project, or we'll just arrange the transportation. And such a way we have developed the complete module of Bleed with Pride. Today we are reaching out. So today we have started our project in India recently, and we have reached up to more than 500 students in the country, and very soon we'll be expanding to a lot more. We're coming up with a new concept called Project Safe Space, where we're trying to develop a menstrual health environment, an empowered space, a space where people discuss this as a topic of health around the school, around the campus. So upon this, we want all the people in the school to be aware about menstruation, to have access to sanitary pad, and a specific counselor who will be guiding them towards reaching out for any medical support required, having a peer council that they can discuss, and a peer council that they can discuss their problems with, and taking it from there, we go ahead and talk about adolescent education and the changes happening in the adolescence. This will be comforting when you start from a prepubertal age and get into puberty. So that is about the Project Safe Space. And initially we had lots of struggle building this concept. Now we've come up with a couple of modules, couple of guidelines, and a complete project design, where we are coming up with module that we can give it to anyone and they can take it up and do it. So the other person who is starting this camping, a medical student who is starting this camping, don't need to invest their time upon it. They can just take the module, go ahead and do it in their own format, following our guidelines. And working upon reproductive health has opened up extreme communication skills, because we are supposed to talk about most stigmatous topics, taboos associated in the society, to the lower economic groups, or to people who are to children underprivileged in their education or in their section of society. And we also talk about these topics to professional people in a sensibility with the problems of their own. So we have a module specific for the age groups, and then upon this we are opening people to talk about reproductive health, because at the end of the day, menstruation is nothing but a topic of health. It's a process happening in the body, nothing associated with religion, nothing associated with curse of God, nothing associated with taboos, nothing associated with a specific segment of a society, or it is just a reproductive process happening in every single woman. And once we talk about this as a topic of health, we'll be taking it to the next level, and we'll be dealing with lots of we'll be relieving the world from lots of health conditions, infections, and uh, conditions, infections, and creating it into a comfortable and easing scenario. Usually when we are on weekends, we spend our free time playing games or going to parties or on a casual hobby-based scenario. But trust me, doing something for some other people is a hobby in itself. You can learn, you can improve your own skill in a very unique way, something you could never even imagine. And these skills could take you a lot ahead in life. By improving yourself and by helping others, you're also improving yourself. I request each and every person and every student in the society, so take up a community activity and develop the guidelines upon it and make it a permanent thing that people can use. So don't just be behind doing one activity and finishing it off. So make it something permanent. Make it a pattern, make it a program, and inculcate into the society. So that's from me, Vishnu Bharadwaj. Thank you.